Peter Barlis here, cardiologist. Now, if you have a condition known as heart failure, there's one thing that we know can actually help manage your condition more effectively. Let's talk a bit about what that is. Now, the term heart failure is not one that I actually like. Heart failure means that the heart is obviously failing, but our aim as doctors working with patients is to actually look at improving the heart function and minimizing symptoms, improving outcome and quality of life. So, by definition, when the heart is weaker than what it should be, or when we say heart failure, we often refer to a reduction in the ejection fraction or heart function. And we've had a separate video on what an ejection fraction is. So I just urge you to have a look at that after you've watched this video, because the percentage of heart function is not what it seems. When we normally equate 100%, well, normal heart function is usually more than 50%. So it can be a little confusing. But if you do have heart failure, the most common cause being blockages in the arteries of the heart, but other conditions such as diabetes, valve disease can also contribute to this. We know that doing one thing can actually improve your well-being, and that is to weigh yourself each day. So weighing yourself each day, what does it all mean and what does it do? Well, it's one of the sensitive markers of fluid building up within our body. When the heart's not able to efficiently pump all the fluid out, and sometimes the kidneys may also be impaired, well then fluid accumulation continues to occur. And as fluid builds up, that equates to increasing body weight. Now, it's often not a very gradual progression of body weight that changes. It's often very acute, and it can happen in the space of 1 or 2 days, where the weight can go up by several pounds or kilograms. So weighing yourself is a very, very simple way to actually monitor how the fluid balance is overall. And it also allows you to potentially adjust the medication that you might be taking, called diuretics. Now, your doctor or your cardiac nurse may have you on a series of medicines that help improve heart function. One of those classes of drugs are fluid medicines, or medicines that we use to get rid of fluid from the body, called diuretics. And there are a couple of variations of diuretics that we use. One you might be on called spironolactone, another one might be furosemide, but these medicines act particularly on the kidneys to help release the amount of salt and water to minimize the amount of fluid that's circulating in our body. Because the less fluid that's circulating in our body, well, the less the heart has to actually pump and work. So weighing yourself each morning, and I normally suggest to my patients, get up in the morning, go to the toilet, empty your bowel, empty your bladder, and then pop on the scale at a similar time each day. And you'll get a bit of a routine, and jot it down. Have a little diary or an app on the phone, or keep a little record. But keeping an eye on the weight regularly is a very good way to pick up whether fluid is accumulating in your body, and often can occur before symptoms develop. That's right. So before you start getting very breathless, or before your ankles start puffing up, you might find that your weight starts going up by a little. Well, that is often an early sign that you need to attend to this, seek medical help, contact your general practitioner, contact your heart nurse, contact your cardiologist to look at what plan you have in place. And most often, this may be taking an additional amount of diuretic or fluid medicine for a couple of days to actually allow that fluid to escape and minimize the buildup. Because we know that if the fluid continues to accumulate, then breathlessness will develop. You won't be able to lie flat often in bed. You'll have to prop yourself up on pillows or sleep in the chair, and that shortness of breath can cause quite a significant limitation in what you're able to do, and it frequently requires you to come into hospital and be admitted for a few days of management. So To avoid that, we often tell our patients, weigh yourself each day, keep an eye on it. If there is an increase in weight over the course of 1 or 2 days, well, please consult your doctor or your nurse to find out exactly what action plan you need to have. And until the next video, bye for now.